Hello everyone, I'm Xiao Chen, and today we're going to talk about can people with lactose intolerance eat yogurt? And this is our table of contents. First of all, we have introduction, and second is the myth and hypothesis, and result of studies, conclusions, references, and last the credits. And here is our introduction. First of all, we're going to talk about the yogurt. As we know that yogurt is fermented milk products and it contains a lot of probiotics in it. And the probiotics can help digest the lactose in it, and sometimes it even creates some lactase, so that this is why when the people with lactose intolerance can still consume some yogurt. Also, it is rich in protein. And this is probiotics. Probiotics are produced by our small intestine and it boosts our immune system. Also, it can break down the lactose because it contains some lactase in it. And this is lactose intolerance. If you got lactose intolerance, and maybe you will have diarrhea and other some symptoms like you will faint or something. And about 68% of the world's population got this disease. This disease is because that you are lack of lactase, so you cannot digest the lactose.
Next, we're going to talk about a common misconception. Can people who are lactose intolerant eat yogurt? We already know that people with lactose intolerance should avoid consuming dairy products to prevent discomfort. However, according to the information we've shared earlier, more than half of the world's population is lactose intolerant. So, does that mean they can't enjoy yogurt at all? And why are there still so many yogurt products available? We'll provide a detailed answer at the end of this presentation. But before that, let's first talk about what lactose intolerance actually is. So, lactose intolerance is a digestive system issue. It happens when the body doesn't produce enough lactase, the enzyme that breaks down lactose, the sugar found in milk and dairy products. There are three types of lactose intolerance: congenital, secondary, and the most common one, primary lactose intolerance. People with primary lactose intolerance are usually born with normal lactase level. As a baby, they can digest lactose just fine, but as they grow older, their lactase activity decreases, which can eventually lead to symptoms of intolerance. Common symptoms include diarrhea, stomach pain, bloating, and gas, usually after consuming dairy products.
Eating disorder dietitian Helen West indicates that people with lactose intolerance are not really unable to eat food with lactose, but they can just eat a few without experiencing the symptoms. Actually, not all dairy foods are high in lactose. In comparison with other dairy products, yogurt is relatively low in lactose. In order to take in the nutrients from dairy products like calcium, potassium, and protein, lactose intolerant patients can still have some yogurt. If people still feel uncomfortable after eating yogurt, they can eat less or choose some low lactose, lactose-free alternatives. By choosing them, they can avoid taking in too much lactose, but enjoy the health benefits from general dairy products. Additionally, West says that most people with lactose intolerance feel yogurt is easier to digest than milk. About the benefits of eating yogurt, there are enzymes and living bacteria in yogurt that are good for people's digestive system. Dennis Savagliano, a professor from nutrition science, reveals that yogurt contains high levels of lactase, which helps break down those undigested lactose in the patient's bodies. Also, the lactase and the leaf bacteria in yogurt are resistant to the acidic condition in our stomach. Therefore, they can act to break down lactose in our small intestine.
In conclusion, people with lactose intolerance can still eat yogurt as part of their diet. Like the above mentioned, research conducted by experts has shown that the living bacteria in yogurt can help break down the lactose, making it easier to digest. And this makes yogurt a nutritious and tolerable option for those who are sensitive to lactose, providing important health benefits without causing problems.
So this is our references. And here's the credits. Thank you for your listening today and hope you enjoy our presentation. Goodbye.